Most women think of castor oil as something their mothers or grandmothers kept tucked away in the medicine cabinet, often for things like constipation or skin care. It feels like one of those old-fashioned remedies that got left behind. But what if I told you that modern science and even ancient Ayurvedic practice are now confirming that castor oil may hold a surprising number of benefits, especially for women in our later years? Over the last 30 years in my medical practice, I have seen women go from being frustrated with chronic dryness, painful intimacy, or stubborn skin conditions, to finding relief and comfort with a little bottle of this humble oil. Today we are going to discuss what really works when it comes to using castor oil for women's health after menopause, including safe and practical ways to apply it down there, how it can support skin that has become sensitive or dry, and even how it might ease the discomfort of hemorrhoids or cysts. Welcome back to the Female Health Hub, where we create a safe and respectful space to explore natural approaches and scientific insights that truly matter for women over 60. My name is Lia Parker. I am a gynecologist and intimate psychologist with 3 decades of experience, and it has been my privilege to walk alongside thousands of women as they navigate the second half of life with strength, dignity, and often renewed joy. Today we are exploring how castor oil, when used correctly, can become a gentle ally for your skin, your intimate health, and even your overall comfort. Because according to a study published in the Journal of Ethnopharmacology, castor oil contains a fatty acid called ricinoleic acid, which has been shown to have strong anti-inflammatory and healing properties, and when combined with women's lived experiences, both in my clinic and beyond, it becomes clear that this simple oil deserves a closer look. One of the most common concerns I hear from women over 60 is this: why does it feel like my body has turned against me? For many, the biggest change after menopause is not just the hot flashes or the changes in sleep. It is the silent discomfort of dryness, itching, and sometimes even pain in our most intimate area. I remember a patient, let us call her Margaret, who came to me at age 68. She had been widowed for many years, but recently met a wonderful companion. She told me with tears in her eyes that she was excited about intimacy again, but every time she tried, the pain was unbearable. "It feels like sandpaper," she whispered, embarrassed. And she is not alone. Millions of women quietly suffer the same thing. This condition, which we call vaginal atrophy or postmenopausal dryness, happens because the tissues become thinner, lose elasticity, and produce less natural lubrication. For decades, doctors have offered hormone creams, which can help, but not every woman is a candidate for hormone therapy, and many prefer not to use them. This is where castor oil, surprisingly, can make a gentle difference. Unlike synthetic lubricants that simply coat the surface for a short time, castor oil penetrates the tissues. Its fatty acids improve hydration and flexibility, while its anti-inflammatory properties calm irritation. When applied with a soft touch, either massaged gently with clean fingertips or absorbed through a simple cotton compress, it can begin to restore comfort over time. Margaret began by warming a few drops between her hands each night and massaging it gently along the folds of her vaginal area. Within weeks, she told me she could sit, walk, and even laugh without the constant burning sensation. More importantly, intimacy became possible again, without fear, without pain. Science supports her story. Studies show that ricinoleic acid, the key component in castor oil, stimulates circulation and reduces inflammation, which helps bring nourishment to tissues that have grown thin and fragile. In practical terms, that means less dryness, fewer cracks, and more comfort. Of course, castor oil is not a cure-all. Every woman's body reacts differently, and I always remind my patients to start small, just a drop or two, applied gently, and always with a protective liner or cotton cloth, since castor oil can stain. But for many women, it has opened a door they thought was closed forever. The chance to feel at home again in their own body and to reclaim intimacy without fear. Another quiet struggle many women share with me is the frustration of recurring infections or painful cysts. For some, it is the discomfort of yeast infections, itching, burning, and constant irritation. For others, it is the sudden swelling of a Bartholin's gland cyst, which can feel like sitting on a pebble that only grows larger and more tender with each passing day. These problems can be deeply uncomfortable, not only physically, but also emotionally, leaving women feeling embarrassed and isolated. I think of a woman I'll call Helen, who was 72 when she came to see me. She had tried every cream and pill for yeast infections, but they kept returning. She felt trapped in a cycle of antibiotics and antifungal treatments that only gave her short-term relief. At one point she said, "Dr. Parker, I just want my body to feel calm again." In Helen's case, introducing castor oil compresses made a meaningful difference. The oil's natural antifungal and anti-inflammatory qualities helped soothe the irritation and brought down the redness that had plagued her for months. She began by soaking a small square of organic cotton in castor oil, placing it over the irritated area for an hour in the evening, always using a panty liner to protect her clothing. Within 2 weeks, she reported that her flare-ups were less severe, and her skin finally felt soothed. Similarly, for women with Bartholin's gland cysts, castor oil has been used as a gentle aid. By applying a warm compress, cotton or wool soaked with castor oil, and placed externally over the cyst, it can encourage circulation and reduce swelling. Some women find the oil softens the area enough that the cyst drains naturally, avoiding the need for invasive procedures. And then there is the issue no one likes to talk about, but nearly everyone has faced at some point: hemorrhoids. They can appear suddenly, making sitting, walking, or even resting miserable. One of my patients, an active 70-year-old, told me she could not even enjoy her gardening because of the constant throbbing pain. She had tried witch hazel and over-the-counter creams, but the relief was fleeting. What finally helped her was a simple method: soaking small cotton balls in castor oil, freezing them overnight, and using them briefly as suppositories. The cool temperature provided immediate soothing relief, while the castor oil's anti-inflammatory nature worked gradually to calm the swelling. She called it her secret weapon, something that gave her dignity back in a situation where she had felt powerless. Research backs these stories. Castor oil contains compounds that not only reduce inflammation but also fight certain fungal and bacterial strains. This makes it uniquely suited for issues that combine irritation, infection, and swelling. As always, I remind women that hygiene is crucial. Only use organic cotton or natural fabrics, never reuse compresses, and if symptoms persist or worsen, it is essential to seek medical guidance. But for many, castor oil has offered a gentle, accessible way to bring relief where other methods have fallen short. While most women think of castor oil for digestion or old-fashioned remedies, one of the areas where it has truly surprised me is in skincare, especially for women whose skin has become fragile and reactive with age. I recall a woman named Patricia, who came to me in her mid-60s. She had always prided herself on caring for her skin, but after menopause everything seemed to change. Prescription creams that once worked wonders now left her with red blotches, peeling, and painful sensitivity. She had been prescribed tretinoin, a medication known to reduce wrinkles, but her skin simply could not tolerate it. Even a tiny amount would leave her raw for days. Patricia's story is not unusual. After menopause, our skin naturally loses collagen, moisture, and resilience. For women with conditions like rosacea or eczema, this sensitivity is even greater. Many tell me they feel like every cream either burns or does nothing at all. What shifted things for Patricia was the introduction of castor oil as a protective base layer. Each night after cleansing and patting her skin dry, she massaged a thin film of organic castor oil into her face, focusing on the driest areas. Then she would apply her prescription cream on top. To her surprise, not only did her skin tolerate the cream, it began to improve. The oil acted as a buffer, reducing irritation, while its own fatty acids nourished and calmed her skin. This matches what research has found. Castor oil contains antioxidants that protect against free radical damage, and ricinoleic acid that soothes inflammation. Together, these properties can reduce redness, support healing, and restore moisture balance. Some studies even suggest that massaging castor oil into scars or stretch marks over time helps soften their appearance, as the oil penetrates deeply into connective tissue. But there is another side to this story. Some women find that castor oil feels heavy, even greasy. For them, I recommend starting with a very small amount, just a drop warmed between the fingers, applied only to areas of greatest need. Over time, the skin often adjusts, learning to absorb the oil more fully. I remember Patricia laughing as she told me that the only problem she had with castor oil was that her hair would sometimes stick to her face at night. Her solution was simple: a soft sleep cap to keep her hair tucked away. She said, "Dr. Parker, I finally found something my skin says yes to." For many women, castor oil will not replace every cream or treatment, but it can be a gentle companion, an affordable, accessible way to help the skin stay comfortable, nourished, and resilient in this new stage of life. Beyond the skin and intimate areas, castor oil has been valued for centuries for its internal effects. Our grandmothers often spoke of it as a cleaning oil, something taken by the spoonful to keep the bowels moving. While I never recommend using castor oil recklessly, there is some truth in its role as a gentle laxative. I remember an older patient of mine, Eleanor, who was 75 and constantly battling constipation. She was frustrated with fiber supplements which left her bloated and laxatives, which were too harsh. Together, we explored the careful use of castor oil, not daily but occasionally when she needed extra help. With just a small measured amount, she was able to find relief without the violent cramping that some stronger medications caused. Modern medicine confirms this. Castor oil stimulates the intestines, encouraging movement. However, it must always be used with caution, as too much can lead to severe diarrhea and dehydration. It is never meant for long-term or frequent use without medical guidance. For women with gallstones or those who are pregnant, castor oil should not be taken internally at all. Safety always comes first, but digestion is only part of the story. In Ayurveda, castor oil has been described as balancing both air and water elements in the body, supporting not just the gut but also the joints and muscles. I have seen women with stiff knees or aching backs massage castor oil into their joints nightly, sometimes with a warm cloth over the area, and report that it eases their stiffness by morning. One woman, Anne, age 69, had struggled with arthritis in her hands for years. Simple tasks like holding a teacup or writing a note left her in pain. She began gently massaging warm castor oil into her fingers before bed. Within weeks, she told me that her mornings were no longer ruled by stiffness. While it did not cure her arthritis, it gave her comfort and allowed her to do the small daily things she valued. There is also some evidence that castor oil may support the immune system. Research suggests it can increase circulation of certain white blood cells that fight infection. While this is still being studied, I have found that many women feel more resilient when they use castor oil regularly on their skin or in massage. Whether it is the physical effect of improved circulation or the emotional comfort of self-care, the result is meaningful. Women feel stronger, calmer, and more in control. So while castor oil should not be thought of as a miracle cure, it does seem to have a role in digestion, in easing joint discomfort, and in gently supporting our body's natural defenses. And sometimes that little extra support is exactly what we need in the second half of life. As we come to the end of our time together, I want to pause and reflect on what we have learned. Castor oil may look like an unassuming bottle of thick liquid, but for so many women it has become a quiet ally. We have seen how it can soothe the discomfort of vaginal dryness and even restore intimacy, how it can calm infections or cysts, how it eases the sting of hemorrhoids, how it protects sensitive skin, and how it may support digestion, joints, and even immunity. But let us be clear, castor oil is not magic, nor is it a cure for every problem. What it offers is something more subtle and perhaps even more valuable. It is a tool, a companion, that supports the body in doing what it was designed to do. For many women, especially after menopause, that support is enough to bring real comfort and dignity back into their lives. I encourage you, if you decide to explore castor oil for yourself, to do so thoughtfully. Choose organic, cold-pressed oil in a dark glass bottle. Start small, test gently, and most of all, listen to your body. And always remember, if symptoms are severe or persistent, your trusted doctor should be part of the conversation. Over the years, I have found that what women crave most is not just information, but reassurance that they are not alone. If you have tried castor oil, whether for your skin, your joints, or your intimate health, I would love for you to share your story. Your experience may be the very thing that helps another woman take her first step toward relief. So I leave you with this question: have you ever used castor oil in your daily life, and what did it do for you? Please share your thoughts in the comments. I read them carefully and I know other women here do as well. Thank you for spending this time with me today. Together we are creating a space of trust, knowledge and compassion, where women over 60 can feel heard and supported. Until we meet again, I wish you comfort, confidence and above all, health in this new and beautiful chapter of your life.